Hi, I'm Dr. Kristi Hustak, a board-certified plastic surgeon in Houston, Texas at the Aesthetic Center for Plastic Surgery. And I'm joined today with Summer, and both of us together wanted to chat a little bit on vaginal rejuvenation. We would love for you to stay towards the end of the presentation, where we'll kind of treat it like a virtual consult, where you'll have an opportunity to ask questions in the questions tabs, and we'll answer those live. So definitely stay to the end to ask us those burning questions you may think are taboo and haven't really thought to ask before. We're here today to answer those questions for you. As a reward for tuning into this webinar today, we wanted to reward you with $500 off a surgical procedure or surgical vaginoplasties.
On the med spa side, you will receive 15% off of any ThermiVa package and the Oh My Shot packages. One lucky winner will end up getting the JoyLux V-Fit Gold. This is going to help improve your intimate wellness. The winner will be emailed. If you want to book a consultation, then just reply to the text that you'll receive and we can take care of that for you.
Stay tuned to the end. So what is symptoms of vaginal laxity, and why do you even need a surgical or non-surgical vaginoplasty? Well, women's health is so complex, right? There's so many variables, from functional with your mucosa and your muscles after having childbirth, but also just the mucosa with hormones. So kind of some of that laxity or postmenopausal changes. So this is really a complex problem that's really multifactorial. From a surgical perspective, women complain of vaginal laxity in multiple ways. The most common one is just inability to feel their partner like they used to. So just generating that friction. That's the most common complaint I get. But there's other things like vaginal flatulence, meaning you have some air escape in there during intercourse or just at times of rest. Chronic constipation, where you may have to put your finger in your vagina to have a bowel movement. That's actually more common than you think. Tampons not fitting well, going swimming and water getting in there. Moisture control issues. So sometimes overstimulation of moisture because your entrance is open, where sometimes you just have too much moisture ruining your underwear, which can be an embarrassment sometimes. Also some symptoms of urinary stress incontinence, so coughing, laughing, sneezing, and losing a little bit of urine. All that pelvic relaxation that happens over life, over time, regardless of a baby has come down that vault. Those are the symptoms I see women seeking vaginal rejuvenation with, surgical or non-surgical. From a surgical perspective, reasons women ask for a vaginoplasty all depends on your muscle tone. Certainly there are two different ways that we can kind of tighten your mucosa. Some are off-label, some are on-label. Some of the non-surgical options, Summer will talk a little bit about, but that all depends on what your muscles are doing. If you have symptomatic muscle laxity, so when I examine you, if you can't kegel or flex on my finger, and if you had discontinuous flexion, so one side flexes but doesn't get to the midline, and the other side does, there's an imbalance there. And then point of weakness is your rectum. So your rectum can come up in between those. So my job and what I do is take out that little bit of extra tissue that's there centrally and put those muscles back together. It's a big old sling. So by putting that muscles back together, I restore the strength of your pelvic floor and your vaginal tone. So that way you have a little more stimulation with intercourse, a little bit more friction, things like this. So it's not a true prolapse surgery by any means. This is more of a cosmetic vaginoplasty, which is increasing friction by fixing those muscles in the posterior vault most commonly. Downtime wise, lots of times I get questions on how long the procedure takes and what the downtime is. Most of these can be done awake under local. I actually have a technique which uses a pudendal block, which is a type of numbing to a nerve that goes to this region, and that's how I can do it awake under local. I have published on this and I train other surgeons from around the world actually in this technique. So this is something that can be done awake under local to tighten these muscles. Conversely, I oftentimes go to surgery to do this either by itself or in tandem with other procedures, kind of as that comprehensive mommy makeover. Because as you can imagine, changes in your breast and body after having babies downstairs can have some changes as well. And doing all those things together can be quite powerful in restoration after having babies. So that's the surgical portion of it. It can be done awake under local or in surgery. Downtime is pretty minimal. It's similar to having a baby in that there's no vaginal penetration for 6 weeks. So that is a true downtime downtime, and that's just when things are strong enough it can tolerate resistance, but you're quite functional pretty early on. If it's done by itself, I have some women that go back to work the next day with just some Tylenol and maybe some ibuprofen for pain. Certainly some pain pills for a day or two, particularly at night, but most people are pretty functional pretty quickly. You're just on pelvic rest, so lifting restrictions, not a lot of heavy lifting, but you can get back to life pretty quick. Just no vaginal penetration for 6 weeks, ladies.
So for the patients who think that they're not ready for surgery yet, we have some non-surgical options. One of them is the Oh My Shot. That is your own blood product. So we draw your blood and we grab the platelets from it. And those platelets have white blood cells and growth factors, a lot of healing elements to it. And we inject it back into the vaginal area. So it's only 2 injections, we numb you for it, and it's very comfortable. And what you can see from there is you'll start noticing maybe a little bit of tightness. You'll notice increased sensitivity. If you have leakage down there, it helps with urinary incontinence. So you can expect to see improvements in those areas. So another non-surgical option would be ThermiVa. And this is a radio frequency laser that we use in the vaginal canal area and also the surrounding areas like the labia. And what this does is it stimulates collagen production, so it helps with tightness. It also can help with urinary incontinence and to increase stimulation. It also can help with vaginal dryness as well. So that's the great thing with these non-surgical options is they work to deliver really good results. We do suggest about 3 treatments of this to get the best results possible. And you can always supplement those treatments with a once-a-year treatment after that. So for the patients who are interested in the ThermiVa treatment, we want to make sure they've had a clear pap smear within the last year. And that is because if you have any abnormal cells on your cervix or in the vaginal area, then the radio frequency can change those cells, and we don't want to spread anything either. That's not a concern with the Oh My Shot, but for the ThermiVa, we do need a clear bill of health and a clear pap smear. Hi everyone, I'm Nurse Summer at ACPS, and we are about to do the PRP injections for the vaginal area, and this is going to help improve the tissue in the area. It's going to help with urinary incontinence and also sensitivity. So it can do a plethora of things. It's going to do so many good things for this patient. She just got sat down. I put some numbing on her so that she's numb in the entire area, and I just drew her blood. It just got done spinning, so you can see the plasma versus the red blood cells, and we're going to be taking this whole top portion. It has white blood cells in it, it has growth factors, so a lot of very healing properties in this. So the beautiful thing about the vaginal rejuvenation treatment is that there is no downtime. So you can go work out after, you can resume sexual activity. You really don't have a lot of sitting still and things that you need to worry about after treatment. You can also start to notice a difference after your treatment in as little as 1 week. But some patients, it takes about 8 to 16 weeks to see a difference because that's when collagen starts forming. So it depends on, what was actually the problem in the first place, and it also depends on your body and how fast you react to it.
Why should you choose ACPS for your vaginal rejuvenation? Well, the reality is there are so many wonderful providers. This is kind of a shared space between med spas, plastic surgeons, and our wonderful urogynecologists and OBGYNs. There is no right answer and one size that fits all. Certainly, there are so many women that have symptoms that can benefit that I think my goal is to get the word out on what we can accomplish non-surgically and surgically. Surgically, this is kind of a specialized area and niche. This is something that we train plastic surgeons in now. This used to be a taboo topic. And so nowadays we train in this. I'm a national publisher and provider of this. I certainly do a good amount in Houston, Texas, and have trained a lot of local surgeons on this technique. My goal is to have every woman that has access to this. So whether it's with me or one of these wonderful providers in town, I think you can't go wrong.
All of the providers here that do the vaginal rejuvenation treatments are very well versed, and we all have experience with these patients. We're very comfortable with this area, and we try to make it as comfortable as we can for you.
ACPS has set the tone for these procedures in Houston, Texas. We would love to help you along your journey. Hey, Dr. Kristi Hustak here, as well as my colleague. Go ahead and introduce yourself.
Hi everyone, I'm Summer. I'm one of the nurses here.
I know we were overwhelming you with tons of information. So certainly there is a questions tab. I already see some of this starting to come in, but we wanted to give you guys the space to ask these questions. They'll be anonymous in how we answer them. So feel free to ask all of those crazy things because this is really for you. Part of why we did this today is not a lot of people still know about this. So unless you have a girlfriend that's maybe talked about this or had this done, lots of people still don't know that there's options down here. Our goal is to empower you and give you the information. What you do with it is totally up to you. TMI, but I've had some of these done myself. I think there's a massive benefit for women of all ages, having babies, nulliparous, meaning you haven't had any kids before, moisture issues, postmenopausal issues, like all of us at different walks of our life could benefit from some of these non-surgical portions in particular. My goal is that you never have to have the surgery, but that's just not the reality with having kids these days. A large percent, 40% of women that have had at least 2 to 3 kids have symptoms of vaginal laxity. So this is a very common thing. After having just one kid, certainly, it's a little less common, but the more subsequent kids you have, the more muscle laxity you have. And some of these other things at all walks of our life we could benefit from. And sometimes it's just, you just want it and that's okay. Sex is a little bit better. Okay. A lot of our sexuality is here. And so if we can empower you functionally, I think it globally makes everything better from a confidence standpoint and then from a gratification standpoint.
Yeah.
So I think we're going to try to start looking at some of the questions and we will answer those live. Just a reminder, because you all waited to the very end, you have access to those wonderful specials. My surgical special is that you get $500 off your surgical portion of the procedure. This can be done awake under local or in combination with other procedures in the operating room.
And we have some non-surgical specials. So you'll get 15% off of packages of either the Oh My shot or the ThermiVa, whichever one would be better for you.
All right. So we have a couple questions coming in. I'll take the first one. One of the questions is what are the scarring like? Is it minimal? Is it visible? What about if you're a bad scar? The beautiful thing about these surgical procedures down here is mucosa has different memory. There is no such thing as a keloid in the vagina. The fibroblasts are just different, those cells that make hypertrophic scars. As you get external, so in the hair-bearing region of the mons pubis, that's a different story. But in the labia and in the vaginal mucosa, there is no such thing as a keloid. It has totally different memory. The scarring does very well here. And one of the treatments for scar massage is using it. So, at 6 weeks when we release you, between 6 and 8 weeks, you can start using it and that will help that scar tissue soften over time. So no such thing as a keloid in this region. Great question.
Which is amazing. Let's see.
I guess some of the possible complications, maybe you can take that from a non-surgical side.
Yeah. So for the Oh My shot, that's using your own PRF. So there really isn't a lot of complications that can happen from this, which is amazing. I feel like the only thing, if you are very healthy and maybe you don't have any issues down there with moisture or urinary incontinence, and you don't have trouble with laxity or anything, you just might not see much of a difference, but we know that it stimulates collagen, which is good. So not much to happen with that, but with the ThermiVa, a complication, if you have an abnormal pap smear, then if you have abnormal cells on your cervix, that can spread around because we are using a tool that goes in and around the vaginal canal. So that could be a complication, but that's why we have to have a clear pap smear before you do it.
How much does a vaginoplasty cost? So the surgical portion is $6,500, $500 off is $6,000. That's where they start from. Of course, if you start adding stuff, that adds to it, although you get multi-procedure discounts. Mm-hmm. How about from your end?
From our end, each Oh My shot is about $1,100. If you do the package of 3, then you'll get 15% off, which we do suggest the package of 3. And then for the ThermiVa, a single treatment is about $1,300. So same thing, you would get 15% off of that as well.
What procedure is optimal to address lack of lubrication? Non-surgical all day long. Surgery is to really tighten the mucosa or the muscles. But when you're talking about mucosa, you want that to be remodeled. And that is, what I call the hot stone massage for your vagina all day long. Mm-hmm. So that is where ThermiVa and all these other heat devices do really, really good. It helps remodel mucosa, it helps those lubricating cells make more moisture. That's super important perimenopausal and postmenopausal. This is actually a treatment, and my gals that have a history of breast cancer or can't take hormones for any reason. Of course, topical hormones and oral hormones are a way that can replace some of that. But if we're just talking about not hot flashes or some of those hormone replacement symptoms, just looking at local lubrication, ThermiVa is the way to go. So my gals that can't take hormones, this is a great choice for them, particularly with vaginal atrophy, which is something that happens postmenopausal. Yay, we'll all get there at some point, and that's why these really come into play. How would I know if I would benefit more from vaginoplasty or ThermiVa?
Well, I feel like if you do have a lot of laxity, like what you said in your video, if you have trouble keeping a tampon in, I feel like maybe the vaginoplasty would be better for them, don't you think?
Yeah. I mean, I think that's where we would come in with an exam. So usually we can tell right away kind of what that's doing. Now, if you're a tweener, because there are some people that maybe you can generate some tone, you just don't know how to Kegel appropriately, because there is an art to that. Lots of times when we try to strengthen our pelvic floor, we're actually recruiting our abdominal wall muscles. So we're not actually trying to tone our downstairs. So there are some tricks and different, muscle stimulating machines and things like that that can help a little bit. But an exam will kind of help you know whether or not your muscle tone is intact. And we can even give you some instructions on how to do those Kegels. There's pelvic physical therapists that actually do this as their whole job. And so there's lots of good tricks and options for that. So as long as your muscle tones are good, I think that you have some great options. And sometimes we do them in tandem. Like I have a whole set of gals that have symptomatic vaginal laxity that we tighten their muscles for, but maybe have a little bit of stress incontinence, things like that. This is not a treatment for, this doesn't replace a bladder sling. This is not a incontinence or even a major prolapse type of surgery. This is a little bit different from that standpoint. Your uterus, your rectum, your bladder all can fall into the vault. If this is the vault, if they can fall in, it's a path of least resistance as we age, but it can also rotate out. And so I don't help that rotation component. I just help that falling in component. So if it's severe enough, my urogynecologist, I'll send you to them so that way you can get a true prolapse surgery. So this is not a prolapse surgery per se, but early grade 1 and 2, this can be a benefit. So, and then complications from a surgical side, infection is actually very rare down here. If it is infection, it's my gals that are prone to either UTI, so bacterial translocation, my patients that are prone to yeast infections, or bacterial vaginosis, which is kind of a pH issue. So those are the most common ones, easy to treat, not a problem. Doesn't even happen that much anymore now that I do probiotics pretty consistently with all those patients. The big complication with surgery, because it's not benign, there's always potential complications, is what we call entry dyspareunia, painful sex as you get started. And this is something I don't want for you, right? I have lots of gals that come in that are like, tighten me as tight as you can. I'm like, there's only so much tightening you can do before I give yourself problems. Certainly what I don't want to do is tighten your vagina so much that you have to dilate yourself up to open it back up, or Botox you because you're spasming. Like that is not a good thing either. And so my marker is usually around 3 centimeters, which is about 2 of my finger breadths on stretch. So that's my target to tighten you. Now there's a little bit of play there anatomically, but that's what I'm going for. A lot of our data shows that tighter than that can give you the risk of painful sex. And that's not an okay thing either.
Let's see, with surgery rejuvenation, are there any follow-up surgeries required?
My hope is this is a one and done. Mucosa is different, right? So it's kind of just like a facial laser. As we age, we're going to need some touch-ups. ThermiVa is not a one and done. It's a series of 3. Same thing with kind of the PRP stuff. It's a 1 and 3. That's your low dose. And then there's maintenance doses every 12 to 18 months. And that's just a single one at that point for maintenance. And again, just like your face ages, your vagina, if you're using it, it's kind of stretching and aging too. So this is just a maintenance dose. From a surgical standpoint, totally different. Unless you have another baby come down that vault, you should never have to tighten this again. Now, I've had one patient over a decade that did have a secondary tightening. Good for her. She had a lot of really great sex. And okay, so we went and tightened her up. But it was not really a muscle problem then. It was maybe a stretch mucosa problem. My hope is you never have to have surgery again. So it's a one and done. So yes, it seems like a major investment, but it's one of those things that you don't ever have to do again, which is fantastic.
And let's see. How long does it take to see results after receiving the PRP my shot? So it depends on the patient, truly. Depends on what's happening in your body, and it can take, it can take about 8 weeks to see a difference. But then I have other patients, logically you would think it would take 8 weeks because that's how long it takes for like collagen to build and everything. But some patients text me like 2 weeks after and they say, oh my gosh, I haven't leaked or had any leakage when I've been running on the treadmill, and it only took 2 weeks. So you can see results really quickly, but it might improve over time.
Yeah. So I think with PRP, there's a little bit of a kind of like 2 phases, right? So your initial phase is your acute inflammatory response. So those are the initial cells that are having all these things come in there. There's a little bit of volume there, and it's like, woo! So it goes a little bit crazy for the first month. So I actually tell people if I'm doing this post-surgical procedure, because I do them in tandem, I don't want to do that when I do your initial vaginal repair because you can't have sex for 6 weeks. So I want to save that at your 6-week appointment. We can do your O shot then so you can use it and get that first month of benefit. Mm-hmm. Then I find it kind of peters out a little bit, and around 3 months when that collagen elastin remodels, they'll see a second peak. And that's the one that lasts you indefinitely. And so what you remodel at that time, the nerve impulses, there's a VEGF stimulation, which is a new blood flow thing that comes with these stem cells. And so all of those things will continue. And so that's when you can kind of repeat it or stack them, like Summer was saying.
Yeah.
Let's see what else. Follow-up surgery requests, we talked about that. Oh, avoid sitting. So after the procedures, do you need to avoid sitting for long periods of time during the first 6 weeks? Not really. Labiaplasty external works a little bit different. You have to stay off your Peloton and things like that. Just naturally that friction's not super comfortable. We give you a little light days, but because this is inside, it's almost like after you have a baby, you're swollen, you're engorged, you're a little uncomfortable. You feel like you're maybe walking a little bow-legged. I promise you're not. Nobody really sees it, but you want to be thoughtful about that. You can take SIDS baths after a week. And then of course, like shower like normal, no intravaginal stuff. So no tampons, no sex for 6 weeks. That's the main thing. But most people are pretty functional. So go back to work, the next day if you wanted to after surgical vaginoplasty. Some people take a couple days, get a little bit of pelvic rest just for the swelling, but because it's all inside, nobody really sees it. Yay. And nobody really has to know.
And does ThermiVa help with tightening? Yes, it does. It has radio frequency, so it does help tighten the vaginal canal. Let's see.
Optimal results. I think you kind of talked about that. How would you determine which treatment is best? Physical exam. Certainly if you have a lot of symptomatic vaginal laxity symptoms, difficulty feeling your partner, then that's probably a muscle issue. Water gets up in there. You lose a lot of air escape with intercourse. Probably surgery is a better option. But if it's sensitivity and if it's moisture, either too dry, too wet, it kind of resets that balance. Those are really great non-surgical things. And I've had tons of patients that did all the whole non-surgical. They didn't want to have surgery and were great. And I've had other ones that did the whole non-surgical stuff. Usually you can tell after 2 sessions. Usually you don't need the whole 3 to know if you're going to have a benefit from it. So I think as long as you have the 2, you're not seeing the results you want, then we talk about doing the surgical portions. And Summer and I work really well together to kind of get that tailored experience for you. And certainly if we do the whole section of non-surgicals and we get to the point where we need a surgical, I'm happy to talk to you about how to make that cost effective as well. Just because you've been in the practice, you've already done a couple things. Our goal is to get you to where you want to go, certainly. So, yeah. Do people that are already scheduled an appointment to qualify for these promotions? I think that's something we could definitely honor. I mean, our whole point is to like give you the benefit, right? So if you're already on the schedule for these, heck yeah, we'll do it.
Yeah.
I'm saying it here, folks. My team heard it. Let's see what else. How successful is the O shot? Does it take multiple times? Can it be too much? Good question. Can it be too much? How long does it last?
So I feel like I've never had anyone regret getting the O shot. Have you?
Never.
Like, yeah, everyone's so happy with it. Can you get it too much? I don't think so. It's your own blood plasma. And so it really can't hurt you. That's the beautiful thing about it. That's why I love PRF, PRP for all over the body.
Yeah. I mean, I had a gal who would come in every like 3 to 6 months for an O shot for a while there, just because she was like, this is great, and I want some more. But I think, really you'll continue to get some benefit up to a year. Mm-hmm. And so certainly that's usually when we see a repeat if you're like, hey, I want some more, because you're continuing to get some remodeling over that year time frame. So mm-hmm. I don't think you have to repeat this after you do your initial loading doses. That's just like, hey, I love it. I want to do it. Why not? So I think an important thing from a surgical vaginoplasty standpoint too is the whole idea is to increase friction. If you're somebody that has never been able to orgasm by vaginal penetration, if you're only an external clitoral girl, things like putting some PRP into the anterior canal and or filler and or vaginal tightening. If you've never ever been able to orgasm that way, me tightening your canal to increase friction for an area of nerves that you may or may not have may not help. I guess that's an important thing to know. So if you're somebody who's never orgasmed by vaginal penetration, I don't want you to think that I can give you that organically with what I'm doing. 15% of women cannot orgasm by vaginal penetration. Fun fact. There you go. I've never seen that on like any, Trivial Pursuit, but if you do, now you know. And so there are just a subset of us that can't. So that's when we talk about O shots or my shots mm-hmm. and some of those things that can stimulate it externally. Mm-hmm. Let's see. Do you tighten the whole canal? Good question. No, you don't need to. So the muscle tone doesn't go to your posterior fourchette. You don't have to go all the way in because there are no muscles towards the back. Like that area is meant to be compliant. One, to fill a space when you're engorged, to make room for a big old endowed friend, or for the babies, right? So there are no muscles in your posterior vault. So I don't need to go all the way back towards your cervix in order to tighten you up because there's no muscle back there. Like there's no point. Now I do want to smooth takeoff. Some women have a short canal, some have a longer canal. That just is what it is. My goal is to go a centimeter past your muscle tone. Some women at 6 centimeters, some women at 7 centimeters, 8 centimeters, etc. So on an exam, I'll see how good your muscles are, where they go to, and then I'll usually go a centimeter past that. So I don't have to go your whole canal because there are no muscles back there to tighten. So there's just kind of no point to give you more areas of painful scar tissue potentially back in the back of the vault. So I don't have to go the whole way, but I do go a pretty long length. Your nerve stimulation is anterior. It's only about 2 to 3 centimeters in. So you don't need the whole canal necessarily to give yourself increased friction. Now I want this to be a nice takeoff, but really as long as you've got 2 to 3 centimeters, you can play ball.
Nice. And then is vaginoplasty suitable for women of all ages, or is there specific criteria for candidates?
It is suitable for all ages, all candidates. For the most part, yes. I mean, if you have muscle laxity, you have muscle laxity. I think if you're somebody who's actively ready to have more babies, it doesn't make sense to do it because another baby coming down that canal or just sitting out on your pelvic floor is going to stretch those tissues. So if you're actively looking to have another kid within the next couple of years, I would recommend waiting. This is not something you want to keep doing. Then we talk about doing some non-surgical stuff. Mm-hmm. So I think those are the instances where I'm like, hey, let's revisit this. Interestingly, as we age and as we lose estrogen, we actually tighten up a little bit. So actually feel tighter over time. So surgical vaginoplasties aren't something we traditionally do in our postmenopausal women unless you're on hormones. So if you're on hormones, that tissue stays lax. It doesn't tighten up the way it does as we lose hormones as we age. So as more and more women are on bioidentical hormones or hormone replacements, we are seeing gals in their 50s, 60s, and 70s having surgical vaginoplasties where that was not a thing we had 10 years ago. But as these become more popular and we're like, hey, we still want to have good sex, that's an okay thing. Then we're noticing we're doing it into later years. But that's kind of the nitty gritty of that.
Ooh, I like this one. Does the vaginoplasty include cosmetic fixes like extra tissue down there in addition to tightness, or would that be an additional cost?
I think it depends on which area it is. So intravaginally, lots of times there's some hymenal tissue. So, I mean, I don't want everybody to go get some mirrors down there, but okay. So if you take a look down there with your legs spread, sometimes inside your vagina, you see these little kind of balls in there that kind of rotate out a little bit. That's usually remnants of your hymenal tissue that you tore when you first had sex. As we age, these tissues kind of relax and pop out. Those are totally normal. But sometimes they get in the way, or they drive people nuts, or when they see them, it freaks them out. And so those things, as I'm tightening your vagina, if they're near my repair, are going to drive you bonkers or in my way, I will take those at the same time, simple little sutures. So that is included, as is the opening of your vagina. So what we call the introitus. That repair or perineoplasty is included with majority of internal vaginal work. So as you come out, I tighten up the opening, I tighten up your perineal body at the same time if your muscles are relaxed there too. That's all part of the $6,500. Now, if you are somebody that has extra labial tissue, inner lips or outer lips or clitoral hood, that's a different cost because those are kind of different anatomic structures.
Mm-hmm. And you can even do that alone, which is great.
100%. Yeah.
If you don't need the vaginoplasty, you can do the labia, which is great.
Yeah. Sometimes I get a lot of questions about redundant hemorrhoid tissue. So if you've had hemorrhoids in the past and they are not having issues with hemorrhoids right now, but you still have the redundant skin, not it. Unfortunately, I don't go down there even with the perineal body. I stay out of your rectal canal. On occasion, there's extra skin tags in your perineal body. Those I'm happy to take care of. But as we march back towards your rectum, me taking off that little bit of skin does no good for you for recurrence. It's a super uncomfortable procedure and it's totally different. You want to go band those. And that's our colleagues in colorectal surgery.
Awesome. And then what other surgeries are most commonly performed with the vaginoplasty?
I think, again, that's totally personal preference. I think that is a functional thing that comes with having multiple babies. So the tightening of the vagina plus a perineoplasty, that is kind of its own separate entity. The external stuff is a little bit more just depending on your anatomy. Lots of times as we age, if I'm doing a tummy tuck, we'll look at the balance of your labia majora. So as I lift your mons pubis, if you still have some fullness there, sometimes I'll take a little bit of that labial tissue at the same time just to rebalance you. Inner lips is actually a genetic thing. So the majority of women coming in for labiaplasties can tell you they've always had a little bit bigger. They maybe notice that elongation with hormones and pregnancy over the time, but generally speaking, that's embryologically analogous to the shaft of the penis. And so you were going to have big ones or you weren't. And so most of my gals coming in for that have known that they've had that since they developed, 12, 13, 14 years old. It's just something they lived with and it never really bothered them. But as they got older, maybe they lost some fat in their outer lips. They became more pronounced. With kids, they elongated, they darkened, they're a little bit more uncomfortable. So those are the ones we take off the labia tissue, labia minora stuff.
Yeah. Do a lot of people get like breast implants and then a vaginoplasty?
Absolutely. Yeah. I mean, you can do vaginoplasty with anything. I mean, you can do that with breasts, you can do it with body, you can do it with lipo. I mean, those are totally separate things. I think it's a natural thing to do as part of your mommy makeover because those things go in tandem. But no, I mean, I do labioplasties and like a neck lipo sometimes. You know what I mean? Like it can be, those things aren't mutually exclusive, certainly.
Awesome.
Yeah.
And then can you combine both ThermiVa and vaginoplasty?
Absolutely. Do it all the time. I think ThermiVa and the Oh My shots do much better for stress incontinence. Surgical vaginoplasty is not a treatment for stress incontinence. It's a sling. So by tightening up portion of the sling, sometimes it transiently helps kind of low grade, but I actually think this is a little bit better for that. So a lot of my patients, I'll talk to them and usually I can examine them and say, hey, this may help. We'll know it's 6 to 8 weeks. If it doesn't, then we have some awesome non-surgical stuff that we can combine. Again, I do that at 6 to 8 weeks at that follow-up when I get you released for sex because I want you to get the biggest bang for your buck. So that's the time I would do that.
Mm-hmm. And someone said the air is so embarrassing.
I know. It just is what it is.
It
for sure.
can be, but also like it's so natural. It's a part of life. And if you are embarrassed, come see us and we'll take care of you.
We've got some great options for that for sure.
Have any of the patients said that the Oh My shot has helped them have better orgasms? Yes. So that's the beautiful thing about the Oh My shots. Your orgasms, if you do orgasm already, sometimes people say that they are stronger and longer, which is really great. And I've heard this from multiple patients. They come back and they're like, oh my gosh, my orgasm lasted a long time. And that's, that's very exciting to hear. So it does help with that.
Absolutely. I've had patients say that they can have multiple orgasms in succession. I've had some that said it was been years since they've had a really good one. They were able to have one. So I think, I think globally it's been a pretty positive thing for sure. So, and just as a reminder, at the end of this event, you will get a text message talking about the virtual event. And so if you text back RENEW, RENEW, we will send you some links for contact for consultations. So be on the lookout for that. So I think we have time for maybe one or two more questions that we missed.
Can you do the O shot and ThermiVa together? Yes, they work really good together as well. And, if you just need a little extra, then this is absolutely wonderful.
How much is the cosmetic part if you only wanted to do just that, like a labia minoroplasty, for example? Certainly cheaper. I think those start at $4,500 if I'm not mistaken, but certainly multi-procedure discounts for doing multiple things together. Those can be done awake under local, sometimes just a little bit of clitoral hood tissue, things like that. Less one side versus both sides, outside lips. There's a whole spectrum. Who'd have thought there were so many things down here that we could give ourselves more confidence in if we're having some issues. So, but that's kind of some starting prices. Certainly Amy or Alba, which are my patient coordinators, or Leslie can kind of get you some more information. So when we text you, text back RENEW, and we can give you some more information for that. Totally free, happy to do that.
And Dr. Hustak, do you often get asked to do a vaginoplasty aside along with a mommy makeover?
Yes, I do. So that's kind of that concept of that comprehensive mommy makeover. So it's a natural thing that we do these together all the time. There's a lot of good benefits to having just one surgery, one and done, and getting everything kind of lifted back and refreshed and renewed. And quite frankly, obviously everybody's super excited about getting their muscles put back together and their tummy tightened and their breasts lifted. Those are all fantastic things. I will tell you though, lots of gals, because this intimate wellness is so tied up in our confidence and global happiness, that sometimes my gals are like, that was some of my favorite part. Like, yes, all this is externally beautiful and amazing and so happy about it, but that downstairs stuff that nobody sees, that's just for you, is sometimes the most powerful. And a lot of times gals will be like, God, I'm so happy I did that. That was my favorite part of the whole procedure. And certainly the spouses, after the 6 weeks, of course, they're a little bit grumpy for 6 weeks, but the partners are oftentimes very happy, particularly with ThermiVa. Lots of times my spouses will tell me that they noticed difference in laxity, moisture, and some of the orgasm stuff that maybe we don't feel right away first. My gals usually notice stress incontinence first, but lots of times my husbands come back and be like, of course the answer in the beginning is, no, you're perfect just the way you are. You don't need to spend this money. And then they go and do it. And then they're like, hey, when's your next appointment? I'm totally happy to pay for that, because they notice right away, which I think is really powerful. So ThermiVa is one of the few things that I have the husbands be like, man, when's your next appointment? Like, because they're super excited too. So there you go. You just got to sneak in the first one. And then once they know, or they can feel it. And I've had some people do blind tests where they're like, don't tell their partners. And then they go and they're like, wow, they were totally in, and they're happy to pay for the next one, because then they fess up later. So just a thing. I don't know. I'm not saying being dishonest. I'm not saying that, but certainly this is something that the spouses actually notice as well.
Yeah. You want to do one more question?
I think this is maybe asking about a hymenectomy. Hymenal repairs or hymenectomy. Certainly, if you're having issues where you're getting some chronic scar tissue down here, where you need some releases in the hymen, there are some times that I've helped do that. I don't necessarily do as many hymenal repairs. I have done over time. I think that's a very intimate conversation I'm happy to have with a gal to see if that's the right answer for you. I have done it on occasion. It's not something that I do routinely, but certainly something to have a conversation with if that's you're interested in.
Awesome.
I think we might be close to done. I know we talk very fast. I know it was tons of information. Thank you for tuning in today. Maybe it just sparked at least some questions where you can do some research, reach out to us. Again, we are always happy to answer these questions. Social media, in person with consultation. Sometimes an exam can really put you in the right direction. And from a surgical standpoint, there are plenty of times I've seen a patient and been like, you're good. You don't need me, so this is not like if you're coming in, oh my gosh, I'm gonna have something done. Usually most of us are pretty aware of our body, but just letting you know what the anatomy is like and the balance. I'm always happy to do that and just kind of walk you through things that we can do or just kind of put you at ease sometimes. Some women are like, oh my God, what is this? And I'm like, oh, totally normal, totally natural. If it bugs you, I can do something about it. Otherwise, you're good to go. So we are always happy to visit with you, examine you. There's so many things we can do down here. It's really a wide open field, and that was not a pun intended. And so we would love to chat with you a little bit more. So again, look for the text message, text back renew, $500 off surgical procedures. The med spa side, you get a discount, 15% off, series of treatments. Come visit with us today. Oh, yeah. Giveaway.
Yes, we do have a giveaway. So, stay to the very end and you can win a JoyLux V-Fit Gold, which is a take-home kit, and you can use it at home. It has red light therapy. It can help stimulate collagen, and, we can do work here in the office for you, and then you can do your part at home.
Yes, it's an awesome maintenance device. So lots of times with my surgical vaginoplasties or my series of ThermiVas, we will get you one of these to go home with. So today you can win one and just use it in the privacy of your own home. There's some instructions in there, but it's a quick 10-minute treatment to kind of stack on what we did in clinic. So yes, giveaway, awesome giveaway. Certainly we've been using versions of this for a couple of years. This is an awesome one. It's the gold one. It's the new one. So definitely look out for that. All right. With that, thank you guys so much for tuning in. Call us with questions.